Today, we are discussing a condition called frozen shoulder or adhesive capsulitis. This is a problem that affects the shoulder joint and causes pain and stiffness, making it hard to move the shoulder. This condition doesn't happen suddenly. It develops gradually and has 3 stages. First, there is pain, then stiffness increases, and finally, the stiffness begins to ease. But this whole process can take several months to even years. At first, pain is the biggest issue. Many people say the pain gets worse at night, affecting their sleep. As time passes, the pain slowly reduces, but stiffness in the shoulder worsens. The good news is that this condition often goes away on its own, but it takes a long time. You might feel frustrated by how slow the recovery is, but with proper treatment and exercises, the pain and stiffness can be managed well. When the shoulder is painful, it's important to continue using the arm, even though it's uncomfortable. This helps prevent the joint from becoming more stiff. But be careful not to do any movements that increase the pain. For example, don't try to lift heavy objects or do any work that strains your shoulder. If the pain is too severe, you may need to take some time off work or stop some activities until you feel better. For pain relief, I recommend starting with a simple painkiller like paracetamol. Take it regularly rather than only when the pain gets bad. If this is not enough, you can try medicines like ibuprofen, but only after checking if it's safe for you. Ibuprofen can sometimes cause stomach problems, so it's important to follow the doctor's advice. Hot packs or warm compresses can help relieve the pain. You can place a hot water bag or towel over the shoulder for 10 to 20 minutes, 2 to 3 times a day. While sleeping, use pillows to support the arm so that you don't accidentally roll onto the affected shoulder. This can also reduce discomfort at night. It's very important to start physiotherapy early. Physiotherapy involves specific exercises that help improve movement and reduce stiffness. These exercises will be simple, but doing them every day is key to getting better. You can also learn how to modify daily activities so that you don't put too much strain on your shoulder. If the pain doesn't get better with these treatments, a corticosteroid injection into the shoulder joint may be necessary. This injection helps reduce pain and inflammation, especially if physiotherapy isn't providing relief. However, injections should only be done by trained professionals. People with diabetes need to be careful if they receive this injection because it can temporarily raise blood sugar levels. If you have diabetes, monitor your blood sugar carefully after the injection and make sure your diabetes is well controlled before getting the injection. If your symptoms do not improve after a few months of treatment, or if your quality of life is severely affected, it's important to consult a specialist. Sometimes, surgery or more advanced treatments may be necessary, but this is rare. Most people recover well with physiotherapy and pain management.